So let's talk about the anosmia from Mac Manual Professional Edition. Let's just start and define that anosmia is the loss of sense of smell. There is hyponosmia, which is reduction in the sense of smell. So pretty much talk about both the same because, for example, an upper respiratory tract infection can cause congestion and can cause anosmia or hyponosmia. So I won't really, uh, let's say, really make a distinct definition between the two. Okay, so we'll talk about loss of the sense of smell. So the smell is important for enjoying for food because, as we talked about in overview, smell and taste. Smell is important for understanding and sensing and feeling the taste of the food, so it's important. And important also for other things. For example, if you have fire near you, it's better if you can smell it, so your house won't burn out. So anosmia, the pathophysiology can cause by by mechanisms that involves swelling obstruction, for example, in sinusitis, chronic sinusitis, or upper respiratory, which obstruct the smell from getting to the olfactory bulb and olfactory nerve in the cribriform plate in the roof of the nose. Olfactory nerve epithelium is destroyed, for example, from multiple sclerosis, from Alzheimer's disease, from stroke, from tumor. We will more commonly talk about Alzheimer's disease and multiple sclerosis as the causes. Remember that something the Merck won't talk about, which is Parkinson. Merck doesn't say a word about it. But Parkinson can affect the sense of smell, taste, and things like this. So, nerve fiber, olfactory nerve fila, bulbs, tract, or central connection are destroyed, and major causes of anosmia are head trauma, because if there is, for example, trauma to the nerve, olfactory bulb, olfactory nerve, or a fracture in the cribriform plate, or the area of the olfactory nerve. Viral infections is one of the most common one. Let it be upper respiratory with congestion, let it be sinusitis, let it be corona, which can cause anosmia, acute anosmia, Alzheimer's disease, which is a neurodegenerative disease, which can cause a degeneration of the olfactory nerve, the pathways, and the brain itself, so it can cause anosmia. One of the most common causes that precede anosmia is upper respiratory, and you can see here how common is it, at around fourth of patients that can present with upper respiratory before anosmia. So if we're talking about causes of anosmia, and we look at the list that Merck shows us, we see allergic rhinitis, which is allergic that cause rhinitis, which can cause congestion and therefore obstruction from sensing the smell. Nasal polyps again can cause obstruction. You can sometimes look and see them in physical exams, sometimes using imaging. Destruction of this is obstructions. Now, destruction of olfactory neuroepithelium, for example, from atrophic rhinitis, which can be caused by a after menopause, a chronic sinusitis with atrophic, something that destroy the mucous membrane. You can see in atrophic rhinitis crust formation, full odor, membrane that is thin and pale. Okay. Chronic sinusitis, which can cause obstruction, mucopura in the drainage, and olfactory neuroepithelial destruction. Again, COVID-19, you can accept what the fever, cough, and the symptoms can be. COVID-19 can present with anosmia. Virus, upper respiratory, medication, for example, amphetamine, estrogen. Okay, toxins. Very interesting that they put here estrogen because sometimes atrophic rhinitis can be treated with. Have a look at this. I'm quite sure that estrogen, use of estrogen treatment, they reported clinical improvement. Estrogen can be used sometimes to help atrophic rhinitis. You can see the local treatment of atrophic rhinitis with estrogen has been described by blah blah blah. So the mechanism by which sex hormone influence rhinitis are varied. Estrogen, progesterone, again, are all expressed. Atrophic rhinitis and estrogen, though this is won't be the most reliable thing, but I'm pretty sure that is associated with decreased estrogen levels, particularly in postmenopausal women. Estrogen plays a role in maintaining nasal mucosa health, and its deficiency can contribute to atrophic rhinitis symptoms. So, as I remembered, estrogen is quite important for atrophic rhinitis. So maybe I don't know why he said that medication like estrogen can cause it, but okay, because it can help it. Okay. Prolonged use of decongestants like decongestants like uh, xylometazoline, which can cause uh, addiction to it and everything else. Toxins, like you can see here, tumors like meningioma that press on the olfactory centers or olfactory neuroblastoma, destruction of the central pathway like Alzheimer's disease, neurodegenerative disease that can cause brain degeneration, degenerative nerve disorder like multiple sclerosis, which can cause damage in different areas of the brain, including the area that are important for sensing smell, head trauma, which can cause trauma to the nerves and the pathways, intraocular surgery, infection or tumor, the same idea, trauma, and in damage to the olfactory pathways or nerve. Again, imaging can help with those ones. Okay, so after we saw the list, we can understand what we need to look for. As the list told us, allergic rhinitis, nasal polyps, atrophic rhinitis, chronic sinusitis, tumors, Alzheimer's disease, multiple sclerosis, head trauma or surgery. We need to look for these things in the history and physical exam. For example, in the history, look for trauma, look for neurodegenerative disease, look for Parkinson, even though they are not telling this, look for MS, look in physical examination for neurological symptoms, look for upper respiratory symptoms, look for polyps in the nose, look for things that can cause it. Think about differential diagnosis. And here they tell you the red flags. For example, head injuries, we said before in the differential diagnosis. Neurological symptoms, for example, for Alzheimer or for multiple sclerosis. Sudden onset, I'm not sure what they mean here, but maybe they mean COVID, or do they mean, I don't know, stroke, or does it mean, I don't know, tumor like meningioma? I'm not sure. Local or global epidemic of COVID-19 because COVID-19 can cause anosmia. Okay, chronic sinusitis, you understand that it causes anosmia, and based on this, based on differential diagnosis, all your evaluation, including CT of the head, for example, for sinusitis, eh, or MRI, for example, for multiple sclerosis, if you think of it, or Alzheimer's disease, if you think of it, and treatment. Treatment is not always successful. Even though you can treat the cause, sometimes you won't cure the anosmia. So you need to remember this. Sometimes you will. I don't know, for example, sinusitis, not always you will bring back the sense of smell even after treating. But sometimes you'll get it better, even partially. So, but remember this. And of course, remembering the time that the patient had anosmia is more vulnerable to things like, I don't know, house fire and things like this. So be aware that nothing bad will happen. And don't forget that geriatrics, uh, in the older ages, there is disturbance in the sense of smell as we get old. So this was about anosmia. Thank you very much. If there are any correctional mistakes, please tell me and or write it down there in the comments. Make manual professional teachers. So thanks to them, and that's it.